Newly confirmed cases of COVID-19 are surging across the U.S., hitting not only major cities, but small rural populations as well. More than 8.2 million Americans have tested positive for coronavirus since the start of the pandemic, leading to more than 221,000 deaths across the country. The U.S. is averaging nearly 60,000 newly confirmed cases of coronavirus each day. Experts are now warning they expect this trend to continue, with more cases being confirmed as we head into the winter months. During an interview on CNBC, former FDA Commissioner Dr. Scott Gottlieb had this to say about the next few weeks of the pandemic.
We're facing a tough circumstance right now. We're going to see accelerating cases heading into the next 4 to 6 weeks, probably into the end of the year right now. It's going to be a difficult fall and winter. I think we're about 2 or 3 weeks behind Europe. So we're about a week away from starting to enter a period where we're going to see a rapid acceleration in cases. And I think November and December are going to be tough months.
Dr. Luiza Petre joins me now. She's a cardiologist and assistant professor of cardiology at Mount Sinai School of Medicine. Dr. Petre, welcome. Thank you for being with us. So we are currently seeing an average of nearly 60,000 Americans test positive for COVID-19 daily. As we heard Dr. Gottlieb say there, the next couple of weeks could be a period of rapid acceleration across the U.S. What exactly does that look like, and what could this mean for the country?
Tanya, what Dr. Gottlieb means by rapid acceleration is we're facing soon to happen an explosion in the number of cases. Looking at the rate of new infections and where the numbers are heading. To put this in perspective, we should have been ideally under 10,000 cases daily, and we have never went under 30,000 cases since July, and now we are reaching almost 70,000 cases as last Friday. So the numbers are very telling at this point.
And as a cardiologist, doctor, what effects are you seeing the disease have on a person's heart, both in the short term and the long term?
Tanya, that's a great question. This COVID pandemic has affected cardiac health in many ways. One, people miss their doctor appointments. We see more uncontrolled diabetes, uncontrolled high blood pressure. All are these risk factors for heart disease. Two, people delayed medical care. We have seen a doubling of mortality from heart attacks as people don't seek immediate medical attention. And three, we are seeing patients admitted with COVID to the hospital, and 1 in 3 patients have evidence of irreversible cardiac damage. So if you look at the whole picture, everyone basically is impacted in a way or another.
That's very frightening to hear. And so, of course, we are going into the winter months now. What makes this time of year such a difficult time to contain the spread of a virus like COVID-19?
The major concern is that as we are heading into winter months with such a high tally of cases, we know that winter weather is very conducive for viral spread because people spend more time indoor. Also, the holiday season is coming. So with no treatment on site, heading toward the winter months, it's really concerning. Plus, we have the flu season, and the two pandemics could collide and create a twindemic.
And of course, as you mentioned, the holidays are just a few weeks away. So many people are wondering, do I plan to have Thanksgiving with my family? Do I, plan to travel for Christmas? Is there any safe way for families to gather and travel during this time? What would you recommend?
Tanya, healthcare experts are very concerned about the holiday season. And here are some basic recommendations. Avoid travel if you can, 1. 2, try to celebrate with your family that's sharing your household. 3, celebrate virtually and weather permitting outdoors.
All right, not quite the Christmases of yore, but I guess we are in unprecedented times. So, doctor, we still don't have a concrete timeline for when we can expect a coronavirus vaccine. How does this impact the virus itself, and what could this next surge mean for the way it potentially mutates?
As I mentioned before, and we are going to witness probably an explosion of cases in the next few cases. We don't have treatments, we don't have vaccines, and this pandemic could be very soon out of control. That's what most experts fear. And again, with the winter ahead, we have to kind of brace ourselves for a tough winter to come.
All right. Well, Dr. Luiza Petre, thank you so much for joining us. We really appreciate your time.
Thank you.